One of the biggest advances in orthopedics over the last 15 to 20 years is hip arthroscopy and the treatment of non-arthritic hip disorders. In the past, there were people who would have a chronic hip problem and it would go undiagnosed because we just didn't have the tools to make that diagnosis. Nowadays, with improvements in MRI, the detail is much greater and we can make diagnoses that we couldn't make in the past. The main injury that people hear about are labral tears. The labrum is a little disc that surrounds the socket. It's almost like an O-ring. And that's really its purpose. It helps to seal in the joint fluid. And in some people, that tissue can tear. And when it does, that tissue can get stuck between the ball and the socket as you move your hip around, and it hurts. So a great technique to fix that is a procedure called a hip arthroscopy. And it's done through typically 2 small incisions about the size of a fingernail. We put a camera in the joint, and then we treat the labral tear with either by trimming any loose tissue, or if we can, and we usually like to, we try to fix it with suture material. Oftentimes these are caused by a little spur or a bump, and at the same time those spurs can be removed. The procedure takes about a half an hour to 45 minutes. You're walking on it the same day and then the days ahead, and in general most people are back to their activities within about 2 to 3 months. I would recommend that anybody having chronic hip pain should come see a board-certified, fellowship-trained orthopedic surgeon to have their hip evaluated.